We are back with a very special guest. I know I am excited about this. So, Krista, we are going to welcome our wonderful guest here, Dr. Charles Raison, who is a professor of human ecology and psychiatry at the University of Wisconsin-Madison. Dr. Raison, great to see you.
Nice to be here. Good to see you, Matt.
Well, you and I go way back many, many years to my days at CNN, and we worked together when you were at Emory, as well as your time at University of Wisconsin. So it's great to be back in touch. As you know, from having discussed this podcast with us beforehand, we're focusing on mental health for entrepreneurs and making sure that people who are founders are getting the mental health resources that they need. And you, for as long as I have known you, have been really focused on a couple things, but particularly what I wanted to start with was mindfulness. And, something that we talk a lot about here on the podcast is taking a break. It's a rat race every minute of every day as an entrepreneur, and really just taking some time and being mindful about the choices that you make. So if you could just start by telling us what is mindfulness, and then we can jump in from there.
Yeah, mindfulness is a very, very old practice. It's complex. I think that John Kabat-Zinn probably had the definition that's been most picked up in the West, which really has to do with paying attention to your current kind of mental state, your awareness of your surroundings, without judgment, right? So, and this actually springs from an old Buddhist idea that I think cognitive neuroscience would certainly agree with, which is that, we don't really see the world as it is. We don't, of course, as humans, we don't see the world as it is because we have certain types of brains and certain types of eyes and receptors. Bumblebees see the world very differently. But even with that caveat, just as human beings, we don't see the world the way a human being can see the world. We see the world overlain with our opinions, our thoughts, our fears, our beliefs. We tend to see the world sort of instrumentally. What's it going to do for me? Where's the danger? Where's the opportunity? What can I ignore? These are the three kleshas of Buddhism. And so what mindfulness at core, I think, is trying to do is help people step away from that and recognize that and try to strip away so that to a better degree, you're able to just be aware of things. And because, of course, it turns out most of us are not mindful at all. Certainly, I'm not mindful. And we're not mindful most of the time, right? Most of the time, we're off someplace else. We're not here. I'm here now with you, actually, because, I have to think, okay, what is mindfulness? But in most of my daily life, I'm worried about what's going to happen tomorrow. I'm thinking about what happened yesterday. I'm fantasizing. And mindfulness is an attempt to, without being overly judgmental, harsh, or condemning, just sort of recognize that phenomenon. And a lot of times, like I remember the first time back when I was a younger person and really got into meditation for the first time, it sounds stupid, but it was a profound existential experience for me to realize how much of my mental space was just off somewhere else, and in fact, it's very, very difficult to just sit and not go off into those other places. So mindfulness is about not going off into those other places, or actually, I think more exactly, it's about recognizing when you go off into those other places, just watching. You watch your brain, you watch your thoughts, you watch what's happening in the world around you. How does your body feel? And when you do that, some people find it very relaxing. Some people find it very stressful. But it is, that's what happens. And a lot of people find it really beneficial. It just makes them more aware of the fact that they exist here now as a person in this time and place. And usually doing that makes people more appreciative of the preciousness of a human life. And when that happens, that tends to make people feel more grateful and more accepting of the limitations and challenges of their lives.
Well, I think, so much of what we talk about on this podcast so far has been about, how busy everything is and, all these things are happening to you and around you, and really just trying to give yourself some perspective on that. I mean, Krista, we talk about that almost every episode, I think.
Yeah. And I think the challenges of being aware, like you had mentioned when you're so busy, but this is really being aware in modern life, which is very different than I think probably where these traditional practices started. Life looked very different then.
Oh, yes, absolutely. in past years, I had a much sort of deeper connection with the Tibetan Buddhist world, and so I knew a bunch of Tibetan Buddhist monks, and I knew them here in America, some really great scholars, and one of the things that they often talked about was how profoundly different life was here, and how different it was in the monastery. They had stripped things down. In many ways, to the far more kind of essential elements of life, and they had a lot more focus. I mean, the problem with the modern world, and this is a problem for people that are CEOs and business leaders, is you got to do 10,000 things at the same time. And
Mm-hmm.
in fact, we know human brains did not evolve to do that very efficiently. That's not the environment that we evolved in. We tended to evolve in environments that required do it one thing at a time, go, go, go. And so there is a crazy unnaturalness to the world that we live in now. And the thing is, we're like fish swimming in the water. The fish doesn't recognize the water because it's all around them. We don't recognize the unnatural and frank, it's just shocking nature of the modern world because we just got boiled alive a degree at a time. But it's very, very different. It's very different from how humans evolved, and it's very different from the world, as you say, that these mindfulness practices first began to arise in.
Yeah. I know that, I adopted a mindfulness practice a couple years ago, and it's been really transformational for me. But as you pointed out, it's also very much of a challenge to, I guess, remain aware throughout your, the activities of your daily life. I find that time in the morning, it's really easy, to sit there in silence and kind of be really attentive. But I think the real skill, too, is when you move through your day, how do you continue that with so many distractions?
Yeah, it's true. I mean, that again, that is a standard thing in classic Buddhism, right? This sort of idea of, how do you take what what you develop on the pillow, on the meditation pillow, and how do you then take it off into daily life? And there's this really rich tradition, or sort of rich literature within that tradition about the challenges of doing that, right? That is the essential challenge, that serious practitioners can develop states of mind when they're in formal sitting meditation that are very, very profound. And it's the transition of those experiences and extending out into daily life that is the real challenge, right? Because of course in their system they're trying for enlightenment, and enlightenment is sort of being able to spontaneously maintain the view of emptiness, they would say in the Mahayana tradition, while simultaneously observing phenomenal existence. And that's really tough, right? Because I got a buddy here named John Dunn, who's up at Wisconsin, this great Buddhist scholar, and he talks really eloquently about the fact that before you become a Buddha in their system, when you really go into the advanced states, the entire world vanishes. You enter into this formless realm that you can't, it's not until you sort of hit this Buddhist perfection that all of a sudden the world arises again, right? And so, that doesn't apply to most of us, but down in the lower realms of just normal daily life, that I think the analogy is that, yeah, how do you take, if you're somebody that benefits from meditation, and not everybody does, and this is a really interesting thing. I mean, some people are actually harmed by it. There's a wonderful woman named Willoughby Britton studies people that have gotten into meditation and were damaged by it. That's true for anything though that can affect your mental state. But the sort of question of how do you translate, if it works for you and if you really get benefit while you're sitting there, what are the strategies for then bringing that out into daily life and practicing, maintaining mindfulness? That's a real challenge. But that is one of the great challenges for people that benefit from meditation, is how can you extend it out?
Well, and the need to come back to this simplicity, in the Buddhist, world, right? Like there's so much simplicity in existence, and really going back, I think, to the basics and not having all of these distractions and things that we accumulate and buy and overcommit ourselves to. That probably, I would say, makes it a little bit easier to continue a practice.
Oh, I mean, this is what all of my monk buddies used to tell me. Sure, of course, a lot of the challenges that we faced were stripped away. They had other challenges, but I mean, the people that are serious, I knew guys. There were guys. There are women that do this also, but I knew monks that had like lived in a hole in the ground for 7 years straight. I mean, just insane sort of removal from the world and focus on these internal states. So, yeah, I mean, there's a wide range of what you can do. And one of the critiques of modern mindfulness is that we have pulled it out of these traditional environments and sort of cleaned it up, sanitized it, secularized it. You can be rich, famous, super busy, and do mindfulness. And your life will be perfect. Certainly, that would never fit with a Buddhist perspective, right? I mean, there are these ethical elements to meditative practices that have largely been stripped from the West. And there's a whole debate about, is that good, is that bad? But it speaks to this idea that you talk about, like, say, the materialism and the accumulation of goods for most of us. That would certainly from a Buddhist perspective, that would be an issue that you'd want to quit doing, right? And then sometimes mindfulness does that for people. I mean, certainly, there's this big study that it's been getting a lot of press lately. This Harvard study on happiness that's been going on for like 85 years. I mean, I remember, I remember reading about this back in the 90s when people were still alive and kicking. And, one of the profound, very simple outcomes of that study was that what made people happy in life was their relationships. Right? And so, power, success, status, it's kind of a rush. If you're rich and famous, everybody in the room kind of kisses your backside. But at the end of the day, in the quiet of your own mind, you know, many of the things that many of us pursue are suboptimal ways of achieving well-being. They're great ways of getting rich and powerful, but if you're interested in well-being, they're not optimal.
Well, and I think that's the big key here, right? Is, how do you maintain this idea that, as an entrepreneur, your idea is going to be the next unicorn. You're going to build this company into something amazing. You're really going to change the world if that's what your goal is. But also you have to stay centered yourself. And, how do you do all that while being a decent human being and not going totally nuts and sacrificing your family and everything that means something to you? And I think
so I've got a kind of a funny perspective on this. Now, people sometimes call me Eeyore. I'm not the like really positive guy in the room, but I'm quite involved in psychedelic studies, and this whole thing is now, it's not just meditation that's interested in this, psychedelics are interested in this, right? So I know of a couple of studies where they're given psilocybin, the active ingredient magic mushrooms, to big business executives, to turn them into, business executives that are also Mother Teresa, And, I'm always interested in this stuff. We try to do the same thing with some of the Tibetan Buddhist monk stuff. And usually what you find out is it doesn't work that way, right? Because one of the problems of the world is that it has actual demands. Right. And there's a rule of life, which is you buy the ticket, you take the ride. And this is why, if you don't want to take the ride, don't buy the ticket. And this is why many spiritual traditions would say, well, for God's sakes, don't buy the ticket. You need to go do something different if you don't want to take the ride. What is demanded in startup, because I've been involved in the startup, I've been watching this for the last few years. What's involved in startup organizations often is something like a religious way of life, in that you got to give everything up. You may say, I'm not going to give everything up. I'm going to do this and that. But at the end of the day, that can make you go crazy. And so there are certain situations where it is very, very hard to balance these things, or to include all these things, or to do all these things optimally. Time is always your enemy when you're living this kind of life. Yep. Right? And so it really is a matter of priority. And I know a number of people that prioritize their families, and it costs them the top rank of business. I especially in science, I've seen that, where people, they just weren't willing to work 12 hours a day every Saturday and Sunday. They had kids, and there's a price to be paid, right?
And certainly in academia,
I have this sort of interest in this, and I've got this sort of, it's not a particularly common perspective these days. It's a little more consistent with Hinduism. This idea that for many people transiting through this life, that there's a way to kind of look at it, kind of almost like a life stage way of looking at it. So, in the Hindu optimized kind of life history, there are 5 stages, I believe, where, you're a kid, then you're a householder, then you're this and that. But the larger idea was that there's kind of a time and place for everything. And really, that rather than trying to be perfect at everything, for many people, it's more optimal to pursue what you want to pursue and pursue it wholeheartedly. I teach college classes, both at Emory and down in Atlanta still, oddly, and at UW. And I often kind of stop the kids kind of stop in their tracks because I say, look into your heart. And what you want to do is be rich and famous, and be a big, powerful person. If you're being pulled toward that and that is the truth of your heart, I recommend you go for it. Now, don't be surprised when it doesn't bring you happiness,
Yeah.
but if you got to do it, you got to do it, man. And sometimes you have to live through things and be satisfied with them to abandon them. One of the things I always worry about with meditation is this thing called spiritual bypass. I see this a lot, right? Where people basically will adopt these spiritual stances as a way of sort of escaping or stepping around deeper psychological problems or
Right.
deeper, issues in their lives. And so I'm always sort of cautious. And so I'm always interested. I'll be, it certainly is possible to be a very, very busy executive doing all this stuff and have more mindfulness. And whether that mindfulness allows you to keep living an impossible life or whether the mindfulness makes you question what you're doing, that probably varies from person to person. But in these psychedelic studies, I always caution people. I say, hey, don't just think that if you have a transformative psychedelic experience, it's going to make you a bigger executive. You might quit being an executive. You may see things differently.
Well,
Mindfulness
yeah.
has some of that same capacity, at least for some people.
Well, and part of the doing some of these things is suspending disbelief, right? So if you start to get perspective on some of this stuff and go, why am I running myself into the ground, or why am I doing this? Yeah, that could actually lead you in the opposite direction. So
Absolutely.
I think what's fascinating to me about all this is, I think we've been told for so long that you can have it all, right? And you can find time to eat kale and do meditation and be, in very good shape and be a great family man or family woman and, go out and do all these things. And there is like this ideal that we're all striving for. But at the end of the day, we're all human beings. We all have challenges. As Krista likes to say, we all have some version of mental illness underlying all of this, whether it's clinical or not. And so you're trying to strive for this sort of impossible. It's impossible in some cases to have it all.
Yeah, it's an interesting thing. When I look at people that are just like these superstars of the world, right? One of the things you often find is they sleep 4 hours a night. That just the universe or God or whatever blessed them with not needing much sleep. And so they buy an extra 4 or 5 hours a day, and they're also super brilliant, and they're super driven, and they're super organized, and all this. But I said it before: time is a limiting factor. There's some kind of equation of how much time you've got and how productive and efficient you are with that time. My partner, for instance, is far more efficient than I am, and it's very irritating. But all of us are a certain kind of way. Like I have a certain level of efficiency, and then you get old. And I'm like 65, so that makes it bad too. Man, 9 o'clock at night, it's like, where's my little tea and a teddy bear? It's time for me to go to bed. It really, I am the classic example of somebody trying to do too many things at one time. I mean, you would laugh if you knew my life in this regard. So I mean, I'm an expert. You brought in the absolute expert on this whole issue.
on doing too much.
It's I don't know. What I've trained myself to do is just like the guy falling down the bottomless pit. The pit's bottomless. You just figure you just keep falling. But it's a real stressor to be trying to do too many things at one time, and time is the limiting factor. So you got to look at that too. I mean, so there's kind of a realistic thing also, right? I mean, we could talk about this all day. It's so fascinating, like what are the advantages of living a life like mine? Jack of all trades, master of none, all sorts of things going on, versus somebody that really focuses on one thing, be it spiritual or be it, pragmatic or be it business, but for sure, all of us have to find some kind of balance in terms of, none of us are going to have it all. And, many of the people that become great entrepreneurs or great businessmen or frankly great spiritual leaders are crappy parents, for example, right? I mean, some of the great spiritual leaders, their children really had negative things to say about them. They were never home, So I do think that where mindfulness can help, I think, and psychedelics seem to do this often for people, is they can help you maybe get in touch with what really matters to you, right? And again, but there's honesty here, right? Because some people say, no, Dad, oh man, I got a family, but no, what really matters to me, honestly, is I want to be rich and famous.
Right.
And, I give people this sort of paradoxical advice. Well, then God, go be rich and famous. Don't Denying your heartfelt desires is a dangerous thing, especially early in life. It's a good way to get depressed, you know.
Well,
So,
yeah, and I think
you
that's
know,
where you hear this, like, nobody ever says on their deathbed that they wish they had worked more. Although there probably are some
no,
people who do say that. You
well,
have to,
there probably are.
yeah,
I probably I've known some of them actually. Yeah, there are probably people that say they wish they had, you know. But this is this is a sort of it's a sad thing about the modern world, and I think it is a result of an evolutionary mismatch that the world is so different. And I mean, we could talk about this forever, but basically, I do think probably in the sort of hunter-gatherer, forager type societies in which humans evolved, this dichotomy between fame, power, fortune, you know, influence, and ability to spend time with the people you loved and your family, that was not, it just wasn't that hypertrophied. Whereas now, because of the way the world has evolved, you know, these often are these sort of diametrically opposed
yeah,
choices, and it's really really hard, you know. And if you say, you know, well, I'm just going to kind of tune in, turn off, and drop out, you know, and I'm going to go, you know, just live for today. That can have its downsides too. You know, I was traveling through the Rockies last summer with my teenage boys, and we were hitting all these hot springs. And in one in particular, I sat and talked with a woman who had lived that life. She'd kind of bounced from place to place. She'd lived for the moment, and she was now probably 65. And I listened to her. It was really sad. There was a real weariness in her and a sort of disillusionment of that life too, right? So, you know, the problem with life is it's just really difficult, and there's no easy way out, and every way is hard, and every way you choose has its strengths and its minuses, and its costs and its benefits. And I think recognizing that, I mean, that's one of the things I think that mindfulness has done for me over the years, is helping sort of just recognize something like that, which many of us, I think, struggle to recognize, so that you're not, you make your choices, and you're going to get the benefits of your choices, and you're going to get the costs of your choices. And trying to get the benefits and not get any of the costs, I mean, you can try. That's not, you know, it's a good thing if you can do it, but it's pretty hard, really.
so
Usually you have to pay the costs of the life you've chosen also.
yeah, and so I think, to put a nice little bow on this section of the podcast, I mean, the idea of mindfulness is it's an ideal, I think, to be able to take a step back, take a look at all of your priorities, and kind of realign and just understand what it is that's important to you and why you're doing it. Would that be an accurate?
That would be a great way to say it. Yep.
Excellent. Well, and I think that's something that we can all strive for, right? Is to just have that perspective. I don't know that I'll ever be a Buddhist monk or be able to live in a hole for 7 years, but I can at least do that and take some time and kind of reevaluate. Am I doing this for the right reasons? Am I doing this because it makes me happy? And I think that's all we can all do. I will say you were directly responsible for one of the most enlightening experiences that I've ever had in my life, which was the ability to actually meet the Dalai Lama, because you were instrumental in bringing him to Emory, and I had the opportunity with Sanjay to interview him. And one of the things he said that always stuck with me too is he said, I can do all this because this is what I do for a living, essentially, right? Like, this is all I do is meditate. So
exactly.
Yeah.
Exactly. I heard him once. Somebody asked him a thing about parenting. He said, no, can't really say anything about that. I'm not a parent, you know. And exactly, I'm a professional. I've chosen to focus on something, very specific. That's absolutely right. I've heard him say the same thing.
Yeah, which I think it's good perspective in and of itself, right? Yeah, unless you have the experience of being a living deity, you don't have the ability to sit and meditate all day long. And
yeah, there's that point. Yeah.
So what I wanted to kind of transition a little bit into, some of the other things that we talk about here, mental illness. We last week we had a really great conversation about the connection between nutrition and mental health. I know, talking about the gut-brain axis. What are your thoughts on that? Because you've been in the mental health field for a long time, both on the clinical side and on the research side, and I think you probably have a fascinating take on that as well.
You mean, like, so in other words, like the gut-brain axis, human microbial interactions?
And what we're doing to our bodies on a regular basis that is potentially, affecting our mental health, and in ways we don't realize.
So this is really interesting, right? Life is about managing relationships. That's the essence of the life. And unless you're like an octopus, even octopus, they have to mix it up with octopuses sometimes. But for a human, we are certainly the most relationship bound species that is a mammal. And certainly, I mean, the ants, but the ants live in these fascist states, which are like hell realms, right? So, for an organism that voluntarily, on an individual level, will seek out the type of interdependence that we exist in, is really quite remarkable. But like all animals, right? I mean, what do you have to do to be on this earth from an evolutionary perspective? You got to survive and you got to reproduce. And if you're going to survive, you got to eat and you got to avoid being eaten. And then if you're going to reproduce, you got to find somebody that's willing to reproduce with you. Um, but if we think about the survival thing and how do we make these things happen? The two main players in this regard for humans are other humans, and then actually the microbial world, the world of the very small. Something we don't talk about that if I live long enough, I'm going to study someday is our relationship with the big animals, right? Like it's not accidental that essentially every hunter-gatherer group in the world sees animals as sort of gods, or that we come from the animals, or there was a great appreciation for the big animals that could eat you. That's something we've lost in the modern world, right? We go to zoos, you don't most people aren't terrified of tigers anymore. But what's interesting is that we had very different relationship with the big animals, but the little things, the bacteria, the fungi, the viruses, have been primary drivers of human evolution, in fact, animal evolution since the beginning of the go, right? And so, if you look across evolutionary time, for humans, up until fairly recently, about 50% of everybody that was born was dead before they reproduced. Most of them dead in the first year of life because your immune system is still immature. So there's very nice data showing that our genetic makeup, past, who we've had sex with, like groups. If you look at difference in human groups, the biggest one is who they've been having sex with. But the second biggest one is the viruses and bacteria that they've been exposed to, because anything that is genetically related that keeps you from dying long enough to reproduce is going to be selected for very, very powerfully. So we have a very complex relationship with the microbial world. And things that activate inflammation in the microbial world, especially when chronic, tend to make us depressed. That's why we now know that inflammation, this is what is inflammation? Inflammation is what your body does when you get the flu, right? You get a fever, you feel sick, you're exhausted, and you get all these inflammatory chemicals floating around in your brain, changing how you think and feel. Um, Organisms that induce that, or stress that induces that, because sadly stress can do the same thing, it sets the brain up to get depressed. But most of the microbial world is not out to kill us. And in fact, most of it either is going to benefit us or we have to tolerate it, because one of the fastest way to die is to spend all your energy chasing after things and trying to kill things that aren't trying to hurt you, right? That's true, by the way, in the human realm. There's very big similarities between the human realm and the realm of the bugs. But in the realm of the microbes, humans evolved in environments where um, most of the microorganisms to which they were exposed, and many, many more than we are nowadays, were either beneficial or neutral. And those neutral organisms are especially interesting because a lot of them live in our guts, and a lot of them used to pass through us on a daily basis. And one of the key things the immune system had to do was learn not to attack them. So the main thing the immune system does is learn what not to go after. That's really, really important. So how did the immune system learn not to sort of learn what it should not go after? And the answer is it was taught that by the bugs that it didn't need to go after. We say the organisms that needed to be tolerated became the teachers of tolerance. Evolutionary processes are a little bit like business. They like to send things offshore if they can cut the cost involved, right? So there's these organisms that are always around, either in our guts or in our food, or in the land, and they're passing through us. They're always there, and so the body then begins to rely on them to sort of to develop an anti-inflammatory phenotype. And there's a lot of good evidence that generally anti-inflammatory phenotype is good for your mental health. Now, it's not always good because you need inflammation to survive things. And there have been some studies showing that things like omega-3 fatty acids that we think of as very healthy because they're anti-inflammatory, you give them to people that are in the ICU, the intensive care unit, and their risk of death skyrockets because you suppress the immune system, boom, they die, right? So nothing is all good or all bad. But in general, you don't want to be wandering around with a pissed off immune system that's sort of cranking out all these inflammatory chemicals and needlessly sort of attacking things like your angry neighbor, so, so,
How
um,
would you know that
how would you know
if your
what,
immune system is very angry all the time?
oh, I draw your blood. I can tell you very easily. We just look at the chemicals in your blood. Yeah. And by the way, people in the modern world tend to have upset, increased immune systems all the time.
Mhm.
Like in hunter-gatherer societies, their inflammation is almost zero. And then if they get infected, it shoots up through the roof. And then if they don't die, it drops back to zero. But for folks like you and me and Matt, our level of inflammation tends to be very constant across
Mhm.
time. And if it's constantly low, you're less likely to die of heart attacks, stroke, diabetes. You're less likely to get depressed. If it's up, you're going to get those illnesses more likely, and you're more likely to die. So how do we keep inflammation down? Well, traditionally we kept it down by having these very close relationships with these anti-inflammatory organisms. Some of them were bacteria, some of them were viruses, some of them were worms. All that's been stripped away from the modern world. And with that stripping away, our microbiomes have changed. So these trillions of microorganisms that live in our guts look very different in the modern world than they do, say, with a hunter-gatherer tribe like the Hadza in Africa. I'm even more interested, however, in these organisms that they didn't live in us all the times, but they were always passing through us, because some of them are even more powerful in terms of how they influence the immune system. And for years, a colleague of mine named Chris Lowry, who's in Colorado, and I have been looking at this thing called Mycobacterium vaccae, which is a microorganism that is harmless. It lives in the mud. It used to be the kind of thing that was passing through our bodies constantly. It's gone now. And when you inject it into animals, at least, it has this profound stress protective effect. It has this profound sort of protective effect on the brain. So we think there's converging lines of evidence to suggest that our separation from these co-evolved, we call them old friend microorganisms, has been one of the causes for this increase in all these diseases in the modern world that were not common a couple hundred years ago: asthma, allergies, inflammatory bowel disease, and we were some of the first folks to argue, and depression, because again, there's these really interesting things where depression rates also rise in cultures as they clean up. So as you enter into a modern environment, you see something. It's happened repeatedly in cultures around the world. The good news is kids stop dying of infection, so you don't die of infection anymore. But what you do get then in return, is increased asthma, allergies, attention deficit disorder, these kind of things, and
Depression.
then probably higher rates of depression. So again, it's a sort of trade-off. What we'd love to do is keep the protection of the modern world, but reinfuse some of these ancient connections in safe ways, so that we were talking earlier about trying to get the benefits and avoid the costs. This is an example of where that would make a lot of sense. And so this is where strategies for enhancing our connection with these anti-inflammatory microorganisms, I think, are promising. Not so clear how to do it yet, but I think it's promising.
I mean, it just really makes sense in terms of evolution and really looking at what you're describing.
Yeah, it's really interesting. It's one of the areas. I mean, it's interesting. There are now people looking at things like fecal transplants for depression, right? So you take fecal matter from somebody or other that's doesn't have the problem. Whether that's going to work for depression, I don't know. But it certainly works for certain very bad bacterial infections. So the FDA has approved fecal transplants for something called Clostridium difficile, which is a nasty infection you get from taking too many hardcore antibiotics. I've known people that ran little businesses collecting, poop from like Tarahumara, runners down in Mexico. And therein is a whole entire insane story. But, so people swear by it, man.
Of course
I know
you do.
people that swear by it. Nothing like, you just need to poop pills every couple of weeks and you can, have the life of an indigenous person. So I don't know, but it's pretty interesting. And it's an area that I think the problem, though, is that it's a lot like the brain. I mean, in psychiatry, we've been at it now for years. We still don't understand like why our antidepressants work. We made progress, but we don't understand the brain. The second most complex ecosystem that we know of in the universe is the gut. And so it's sort of the same thing where it's very challenging, because I know some of the pioneers in this field, and it's very challenging to figure out what it is and how to do it. But I do think it's an area of huge promise.
Well, and that's actually a perfect segue, because the next thing I wanted to talk to you about, you just teed up nicely, which is the current strategies in psychiatry with the different drugs that we're taking. I'm really fascinated to hear about some of the work you're doing with psychedelics. I recently listened to Dr. Andrew Huberman's podcast where he talked about psychedelics and the idea that if this were in fact a serotonin problem with depression and anxiety, that SSRIs would fix it immediately, and it wouldn't take 6 to 8 weeks to see any effect. So, is there something else going on? This is probably not the podcast to get into all the nitty gritty on that, because we don't have all the time. But rewiring the brain, getting things to fire in the appropriate order. I'm really curious to hear what you guys are up to on the psychedelics front, and how that relates to what we're currently doing with antidepressants.
Yeah, well, it's a huge area of interest, right? So, there was a very influential paper came out a few months ago proving that serotonin, depression is not a reduction in serotonin. It's not a serotonin disorder. I think that's true. We've known that for a long time, that these overly simplistic views, they're good for selling drugs. They're not good for science, right? But on the other hand, if you ask yourself, well, okay, so I'm going to give you a psychedelic like psilocybin or LSD, and then you're depressed, and you come into one of my studies and you do it, and now 2 months later, long after the drug is gone, you say, man, I feel like a different person. I feel so much less depressed. What did that drug do to me biologically? The answer is, well, it had this powerful effect at a serotonin receptor, right? Because we know incontrovertibly that the way that psychedelics produce psychedelic experiences, classic psychedelics like psilocybin, is by activating a particular type of serotonin receptor called the 5-HT2A receptor. So, if you want to gamble on chemicals that can really change how you think and feel, serotonin is a good one, man, because that is what's happening when you give somebody a high dose of psilocybin and they have these profound experiences, man. It totally changes how they're feeling, right? So, serotonin is, first serotonin was the answer to everything, and then it was kicked around as, like, we do this all the time in psychiatry. This is going to be the solution to all our problems. When it's not, then forget it. It's worthless, right? And of course, the truth's always somewhere in there in the middle. But you're right that it's complex, because psychedelics are about serotonin. That is what they are about. But they have a very specific serotonin effect. Kaboom. SSRIs are, the regular antidepressants like Prozac, Paxil, those guys. They have a much more general kind of effect on serotonin. It's the difference between like a sharp like knife and kind of a blunt hammer, And the blunt hammer definitely, whatever they're doing there, that's not the immediate thing that makes people feel better. But I'll tell you something. There's some fascinating studies, very, very replicated studies most people don't know about, showing that you can take people that are even not depressed, just give them an SSRI, and then look at their brain an hour later. Brain's activated differently, right? So they'll show people like angry faces versus happy faces, and within an hour of taking an SSRI, you start noticing the happy faces a lot more than the sad faces. And in depressed people, you actually see almost immediately this reduction in the brain's fear area. It's called the amygdala. An hour or two after giving an antidepressant, you don't feel better yet, but without realizing it, this drug has hijacked your brain in a positive way, I guess, but it's changed how you're perceiving the world. And so my favorite theory for how SSRIs, how regular antidepressants work, when they work, is that they immediately, and it is a serotonin mechanism probably, they make you see the world through rose-colored glasses. You're not aware of it yet, but you just, things that look threatening don't feel so threatening. You don't know why. Things look a bit more positive. And studies have shown that when that happens, within a couple of days of starting an antidepressant, long before you're undepressed, the more that happens, the more undepressed you are a couple of months later. So there is a serotonin story there. And antidepressants are not just glorified placebos. They do have biologic effects that are relevant. They just don't work for most people, frankly, very well. That's the problem. And for some people, they probably do a worse job than if you just gave them a sugar pill placebo. There's some pretty good evidence for that also. The problem with antidepressants is, you have to take them every day. They take a while to work. And many people do not get a response, and that's a problem. The other problem is that when people do get a response, a lot of the time they lose it over time. That's a problem. And then I think a really underappreciated problem is that You can be doing great on an antidepressant. You've taken it for a couple of years, you're doing great. Now you want to stop it. They do in studies where they actually rigorously study how you stop an antidepressant. You stop it, you haven't been depressed for a couple of years, you stop the antidepressant, and you're very likely to get depressed again within a few months. Um, there's some evidence to suggest that the antidepressant may make your brain more vulnerable to depression if you don't keep taking the antidepressant. Um, that's a little controversial, but it's worrisome, right? And so, these agents are definitely not a free lunch. Although God knows that they're valuable for people. Man, I got consulted on a case a couple of weeks ago where a woman was coming apart. She's a very high functioning woman, had a family. She tried psychedelics, didn't help her. We put her back on a regular antidepressant, and boom, man, saved her marriage. So it's crazy. So I don't want to be bashing antidepressants, but they're complicated. They're not all sunshine and light either. So.
Well, and I think more of what I was hearing was, that they do work for a lot of people, but we just don't exactly know how they work for a lot of people, and that they don't always work for everybody.
And there's
Right.
the
We know
need
they
for
don't work for
options.
Right.
Yeah.
Yeah, we need more options. That's right.
Yeah.
Right. I mean, that's the thing is, what we call depression is probably 1,000 subtly different disorders, right? I mean, depression is a response to adversity all around the world. If you want to get depressed, the way to get depressed is to have something horrible happen to you, right? I mean, it's really quite striking. So it's not that all depressions are unrelated to each other, but if we had God's eye view, we'd say, Matt, you're mostly it's mostly TNF alpha for you. Kristen, you've got you've got a slight mutation in a CACN1C gene, right? And we'd say you get this, you get that, but we are so far away from that. I mean, that maybe some great supercomputer of the future will figure that out, but that's really a problem. So in the absence of that, yeah, we need more options. We need more options that tend to work and depress people. We need to find a way to make them available to people.
Well, I think that's important, as well as, in my clinical practice, I see people coming in who, they report depression, but, there's a lot of education right there to say, well, that just, people who feel depressed, it's not always a bad thing. It could be something that's gone on in your life. It could be really acute situation, whatever, but kind of trying to understand, what's underneath that, And then there's, the other group, which I would say is, meets the criteria for a clinical depression that requires some more, intensive treatment options.
Absolutely.
So
Yep.
It's important to differentiate, right?
Totally agree. Even the folks that are clinically depressed, I mean, you're really onto something. Depression is often a narrative disorder, and it's sort of just provisional. Where do you decide? This is of all the questions in life, this one is one of the ones that most chases me around. When do you decide that you should address the depression? Let's just take depression. When should you address it as that in fact the depression is trying to tell you something? You're not crazy. You're depressed because, right? And if you deal with the because, that may actually be root out the depression better. When do you do that? And when do you do a strategy that just helps minimize symptoms, right? I'm depressed because I've got an unhappy marriage, right? So when do you say, let's really look into this and explore options? Maybe you need to end the marriage. When do you say, here's an SSRI and, you take it for 3 weeks and all of a sudden things seem fine. What's the problem? Nothing's perfect. That's all right. I'm just going to stay in this marriage. These are diametrically opposed things. And because we can't see into the multiverse, we don't know which option's better, right? But they produce very different outcomes. And because this is relevant to the psychedelics, right? Because psychedelics, when they work, they produce experiences that make people see the world differently, where they go either, why am I in this marriage? This is a repeat of a pathology in my life, and I need to graciously get out of it. And then, they don't just go do it the next day when they're still a little bit wacky, but a month later they do it, and then they feel much better. I can think of patients, I've known many people that have been involved getting treatment in the underground. I'm thinking of one particular patient that's exactly what happened. It was the best thing that ever happened to the guy, right? I've known other people though that they go, they do a psychedelic and they say, nothing is perfect, and in fact, I'm underestimating the good here, right? And then but in both cases, the key point is that they had this moment of heartfelt sense of, oh, this is actually how I feel about it.
Is
The
it
problem with anti,
clarity? Mental
yeah, like
clarity?
clarity,
Like this
right?
sense of
Hmm.
just, it's all
As
clear.
opposed to changing how you feel about it. What psychedelics
Hmm.
do when they work well is they give people this really strong sense that this is actually how I feel, right? And then the drug's gone, right? And then 3 weeks later they say, yes, I realize that's actually how I feel, and so psychedelics are much more on the side of, hey, you are struggling because you've got an issue you need to resolve, and the psychedelics are generally going to make you see that issue. They're going to pull the issue up in a way that you have to face, or they're going to give you a different insight into the issue that you're going to believe is true after the drug is gone. The SSRIs, they can also change how you look at an issue, but the problem there is they only change it while you're taking it. You stop the Prozac and you go back to feeling the way you did before you took the Prozac, right? And so this is one of the reasons I'm so interested in psychedelics, because they may open a door to more often being able to help people deal with their depression by considering it that there's a problem that they need to face, as opposed to, yeah, you're really not doing well, so we're just going to try to make you feel better.
It's a Band-Aid versus a cure. I mean, or at least a
Yeah,
perspective.
I mean, yeah, that's right. And now I've got to put in a caveat though that I don't think psychedelics are going to be a cure for people that are depressed
Sure,
either
yeah.
on any regular basis, especially people that are chronically depressed. We already know from studies that those folks may need to do repeated psychedelic doses, and we don't know yet whether the same efficacy will occur with repeated doses. There's a ton of stuff we don't know, but I can tell you that there are definitely people that are depressed and anxious because they're struggling with a problem, and the psychedelic experience causes them to see the problem differently. And then, years later, they're just not depressed anymore. The early studies that were done in cancer, that was often the case, where people were terrified of dying, and that's why they were depressed. They had a psychedelic experience that made them accept their death. And then if they lived, they never looked at things the same. They had the struggles of life, but that was done away with. And there's a little bit of that in some of the studies of MDMA for post-traumatic stress disorder, because people with post-traumatic stress disorder have a lot of problems. But if they come into a study like that, it's because they had to kill somebody in Iraq, or they were raped as a kid or something like that. And when it's successful, that psychedelic assisted therapy helps them reintegrate or reconceptualize that particular problem. And the data suggests that many people, a couple of years later, they don't have PTSD anymore. They may still have other problems. They may get depressed again, but the psychedelic really seems to be effective for helping people address and face serious problems that are causing them to be, to have mental illness. And they're probably not as good for folks that have been depressed for 20 years. And just the whole thing is just, they're in a world of depression. That's harder for psychedelics, right? But psychedelics are still beneficial probably, but we don't yet understand, for them, they may not be a cure in the same way that they may be for people that are struggling with, single problems, or perhaps people earlier in the course of a depression before they've taken antidepressants for years and before their brains have been changed by the disorder.
It's almost the same outcome you're trying to get with mindfulness, right? Is
Yes.
to get perspective on the issue.
Yes.
Well, and a
Yes,
sense
absolutely.
of spirituality is
Mm-hmm.
really, I think I really promote, like a kind of understanding, like where a sense of spirituality in your life and a deeper connection to, right, like the nature, the people around us and all of those things. And I think that's certainly part of mindfulness, practice, is really being able to appreciate those things. And like, you probably heard of like loving kindness meditation and just really understanding a deeper connection to the things around us helps us to feel not as lonely. And
Yes, and better. And psychedelics do that in spades when they work. And there's now a couple of studies where they've actually looked at mindfulness combined with psychedelics, and there definitely is a synergistic effect. But Matt, to your point, yes, I think that's exactly right. That psychedelics are more like mindfulness. I think not everybody would agree with this, but I think they're more like mindfulness than they are like an antidepressant.
Yeah. Well, and I think that makes a lot of sense to me. I never considered the connection there until just listening to you talk about both of them, one after the other. So, we could talk about this stuff all day. I'm fascinated every time I talk to you because it's usually about something super interesting. I do want to kind of come back to, the base here, the basic stuff here. So, for people who are listening to this podcast, who are entrepreneurs, they're in it, there's a lot of stuff going on around them, whether it's the money issues or the business itself, or the idea is not taking off, or the family is struggling. What does somebody do when they are finding themselves frustrated? Where do you recommend people sort of enter this world of mental health and reconciliation of all this stuff?
Yeah, well, I think the first thing I'd say is it very much depends on an individual to individual basis, right? So again, but I think, this has been an interesting conversation. I think we can do an initial sort of division or bifurcation, right? So if you're that entrepreneur that's really struggling, the first question you should probably ask yourself is, do I want to sort of do something that's going to help me look at my life and evaluate whether I want to keep doing this? And, kind of, do I want to try to understand the problem, or do I want to get something that's just going to help me get through, right? And if you're depressed, then, standard treatments are probably the way to give it a try first, right? Because, I've known many people that were in positions like this where the stress was just wiping them out, and somebody put them on an antidepressant, and it worked for them. And they got undepressed, and they were able to keep going because nothing was as big a deal anymore, right? Mm-hmm. That is a strategy, and that is a strategy that can help people win at the entrepreneurial things they're trying to do. That's one extreme, right? And then the other extreme, of course, is, you can go do something where you really challenge the entire setup that you're doing. But I assume that if you're doing this, it's because you want to do it and you believe in it. And there is where these other elements, none of them is going to be a miracle cure, but we've talked about all of them, right? Eating healthy, sleeping healthy, mindfulness practices for some people are hugely beneficial. Stay tuned on studies in psychedelics and folks that are entrepreneurs and business leaders and stuff. I mean, that we will know that in a couple of years. And then, something I find useful in my crazy life is I remind myself in the morning, I say, if you're trying to do something difficult, don't be surprised that it's difficult.
Yeah.
I mean, it sounds stupid, but it's really true.
I mean, perspective.
Yeah. That's a kind of mindfulness, right? Like, sue me. Dang, this is difficult, right? I'm trying to do something that's extremely difficult. And so if I understand that and I accept the difficulty, I'm not fighting against it. And that is that's a rather profound form of mindfulness in and of itself, just to recognize where you're at. And, if you want to do it, then you buckle your seatbelt and you do the best you can, and don't beat yourself up, because it's still going to be just, it ain't going to be easy, and it's not going to be clean, and it's not going to be pretty, because nothing worth doing that's hard ever is.
Yeah. Mm-hmm. No, I think that's fantastic advice. And I can think of 2 examples in my brain right now of things in my life where I'm like, why is this so hard? Oh, because it's supposed to be hard. That's part of the journey, right? That's why we do these things. We're challenging ourselves. Yeah. No, well, this has been amazing. I know we've kept you for a very long time, and like I said, we could keep you for another 3 or 4 hours. But maybe we'll have you back again soon, and we'd love to hear how it's going with the psychedelics research and whatever else you decide to start researching between now and the next time.
Great conversation. Thanks for having me.
Yeah, no, absolutely. Well, thank you again for joining us, Krista. As
Thank
always,
you.
It's been a pleasure. And if you like what you heard today, please like, subscribe, and share. Make sure that all of your friends know about this resource. If you have questions or comments or things you'd like to see us do in future episodes, you can email us at emotionalrunway@gmail.com. Thank you both again for being here, and we will see you next time.